Hi guys, welcome to FASTCODER21 Medical Coding YouTube channel. The purpose of the channel is to help the people who are in need of medical coding reliable resources. If you are already subscribed to our channel, please help your friends to subscribe. If you are visiting for the first time, then click on subscribe button to receive future updates in medical coding field. The channel is helpful for freshers, experienced coders, aspirants of AAPC and IHIMA certification exams. If you have any other topics or concerns, please mention in the comment section. Please click on like button to encourage and motivate us. Please watch until the end to gain in-depth knowledge about ICD-10 CM, CPT, equipped coding systems, as these Q&A sessions are very useful in live coding, medical coding interview, CPC and CCS certification process. Guys, if you go to any interview, please keep familiar with the code books, as our sessions will assist you in the process of interviews but not an alternate to original interview process or certificate examinations. So today our topic is ICD-10 CM for Gynecology and Obstetrics Session 1. So in medical coding, one of the toughest chapter is chapter 15, which is Gynecology and Obstetrics. In the chapter, some definitions are very useful and you need to know while coding. So in this session 1, we are going to learn what are the basic terms which we need to learn while coding gynecology and obstetrics. Question 1. What is gynecology? Answer. Gynecology is the area of medicine that involves the treatment of women's diseases, especially those of the reproductive organs. As you know, females has reproductive organs. To treat those reproductive organs, we have gynecology section. So gynecologist primarily treats the reproductive organs diseases. Question 2. What is obstetrics? Answer. Obstetrics is the branch of medicine that specializes in the care of women during pregnancy and childbirth and in the diagnosis of treatment of disease of the female reproductive organs. So basically obstetrics includes both reproductive organs as well as the pregnancy. As we have learned just now, gynecology is only for the treatment of reproductive organs, but obstetrics is combination of reproductive organs as well as the pregnancy and childbirth. Question 3. What is gravida? Usually whenever we can find Obgyn documents, we will find this G. So here G is for gravida, means number of times someone has been pregnant regardless of the pregnancy outcome. Twin pregnancy is counted as 1. So what is here pregnancy outcome? Like how many infants are delivered in that particular pregnancy or encounter. So here basically pregnancy outcome means whether delivery occurred or not. So gravida means number of times the patient is pregnant. If it is G2 means 2 times patient is pregnant regardless of the pregnancy outcome, whether she is delivered or whether she is aborted, all those things no need to consider this G. So just whether patient is pregnant or not, we can find using the gravida term. Question 4. What is para? P is for para means number of pregnancies reaching viable gestation age greater than 20 weeks. So if it is greater than 20 weeks only, we can call it as para. Next question, we are going to see one example for above scenarios. Answer. G2 means patient had 2 pregnancies. So but neither survived gestational age of greater than 20 weeks. See, G2 means patient is pregnant for 2 times. P0 means para. So she is not delivered anything. She had pregnant for 2 times, but there is no outcome during these 2 pregnancies. That's why here P0. That means P0 means there are no deliveries during these previous 2 pregnancies. Question 6. What is gestational age? So gestational age is defined as the number of weeks between the first day of the mother's last normal menstrual period and the day of delivery. So whenever you are trying to find the gestational age, we need to check the mother's first day of the pregnancy and the day of the delivery. So in between first day of the pregnancy, first day of the last menstrual period and the delivery day. Question 7. What is premigravida? A woman is pregnant for the first time. So question 8. What is primipara? Answer. A woman who gave birth only once. Multigravida. A woman is pregnant more than once. What is multipara? A woman with more than one pregnancy with viable offspring. Multi means many, para means more than once. What is grand multipara? A woman who has given birth 5 or more times. What is elderly gravida? Pregnancy for a female aged 35 years or elder at the expected date of delivery. Usually we will call it as high risk pregnancy. Question 13. What is young gravida? Pregnancy of a female aged less than 16 years at the expected date of delivery. Usually we will call it as high risk. So if it is above 35 years also high risk, and below 16 years also high risk. But if it is above 35 years we call it as elderly gravida. If it is below 16 years we can call it as young gravida. So but both are high risk pregnancies, so we need to take care. What is antepartum? The period of pregnancy from conception to the childbirth. So the duration between the conception and the childbirth. What is peripartum? The period involving last month of pregnancy to 5 months postpartum. Postpartum means post means after. So postpartum means after the pregnancy, like delivery, after the delivery. So what is postpartum? The period beginning right after delivery and including the next 6 months is postpartum. So it is like after the delivery. See here, right after delivery and including the next 6 weeks is postpartum. What is puerperium? So here puerperium is a clinical term for the postpartum. You can find in the documentation as puerperium or postpartum, as based on this both are same only. What is the general criteria to code obstetric cases? Chapter 15 have sequencing priority over codes from other chapters. We can use other codes from other chapters to further specify the condition. Chapter 15 codes used only on the maternal record. Final character is for trimester. We can't code chapter 15 codes on the newborn records. So these chapter 15 codes are exclusively for mothers. So like maternal record, not for newborn record. So if we use the chapter 15 codes in newborn record, it is a big mistake. So next question, what category we can use in chapter 15, which is pregnancy and childbirth and puerperium. So O00 to O9A, pregnancy, childbirth and puerperium. So basically you can call it as code range. So chapter 15 code range is O00 to O9A. So next question, how can you code if the provider states incidental to the encounter? Answer, if the provider states incidental to the encounter, we need to code Z33.1 pregnant state incidental should be used in place of any chapter 15 codes. So whenever provide documents that this pregnancy is incidental, we need to code Z33.1 pregnant state incidental. Here we can't code chapter 15 codes as it is a incidental finding during the visit. How do you code if a 20 weeks pregnant woman presents with bladder abscess? So whenever a pregnant woman presents with any complication, must and should we need to have 3 codes. Like first code is from O series, like which is pregnancy and childbirth and puerperium section, and next one is for urinary system like N series code, and Z3A series for weeks of gestation. So we need to code 3 codes whenever pregnant woman presents with any complication. In one scenario, so if the code itself, pregnant code itself contains the complication, we no need to code 3 codes. Only 2 codes are enough. Here bladder abscess is separate, so we need to code O series code first, then N series code, and Z3S for weeks of gestation. So we need to check the documentation whether that complication is included in the O series code or not. If it is included, no need to code separate chapter code. If it is not included, we need to code chapter. So what is the average length of human gestation? Usually human gestation is 280 days or 40 weeks. Like usually we will call it as pregnancy duration. So how do you differentiate trimester? So first trimester is less than 14 weeks to 0 days. Second trimester is 14 weeks 0 days to less than 28 weeks 0 days. Third trimester is 28 weeks 0 days until delivery. So sometimes physician will tell the all the weeks of gestation. So we need to remember these three steps to find the trimester of the pregnancy. When does the trimester of pregnancy not applicable? If trimester is not a component of a code, it is because the condition always occurs in a specific trimester, or the concept of trimester of pregnancy is not applicable. So some conditions only occurs in separate trimesters. For example, post dates O480, it will occurs only after the third trimester. So here we no need to code any trimester code. Post date means patient has already completed 40 weeks. After 40 weeks, we can call it as post dates. So in what trimester preeclampsia occurs? Usually preeclampsia does occur in second and third trimester. So how do you assign final character for trimester? Based on the provided documentation of trimester, or sometimes provider will mention weeks. So based on above scenarios, we need to find the which trimester patients belongs. In which situation you can't code weeks of gestation? Generally, we can't code weeks of gestation during abortive outcomes or postpartum conditions. So what is a pre-existing condition? A condition developed prior to the current admission or encounter. So how do you code when a patient is admitted to a hospital for complications of pregnancy during one trimester and remains in the hospital into subsequent trimester? Here we need to code the trimester character for the antepartum complication based on the trimester when the complication developed, not for the trimester of the discharge. So for example, if the patient's admitted in the hospital in the second trimester and she will stay until the third trimester. Here we can code only second trimester, which is the antepartum complication trimester. So how do you code whenever delivery occurs during the current admission and there is an in childbirth option for the obstetric complication? We need to code childbirth code. Guys, I hope you can understand this session. If you have any comments, please mention in the comment section. Please like, subscribe and share. Thanks for watching FASTCODER21 YouTube channel.